Welcome back to another episode of Food, Nutrition, and Wellness with Dr. Dan Remley. Today, Dan Remley is going to be talking with an individual from the Public Health AmeriCorps. So stay tuned. Welcome back to another episode of Food, Nutrition, and Wellness with Dr. Dan Remley. Dr. Dan Remley is a food, nutrition, and wellness specialist with The Ohio State University. Today, Dan has a unique guest that I think we're going to really enjoy. Dan, it's always a pleasure talking with you.
Thanks for having me on again, Patrick. So I want to talk today about a program that we started here with OSU Extension. It is called Public Health AmeriCorps, and we received the grant, and we've been working with this program since May. And so I want to spend some time talking about what it is and kind of what the goals are. And then one of our outstanding Public Health AmeriCorps members, Julia Shin, will talk about some of her experiences with Public Health AmeriCorps. And then finally, we'll discuss, how you can get involved with Public Health AmeriCorps, or if you know somebody who might be interested, how to let them know about the program and how to sign up, perhaps, and apply. Before we talk about our specific opportunities with AmeriCorps, we'll give a kind of brief overview of what it actually is. AmeriCorps is a federal agency dedicated to volunteerism and community service in the United States. AmeriCorps provides opportunities for Americans of all ages and backgrounds to give their time and talent to get things done in the communities that they serve. And so, no matter what you're passionate about, there's a possibility that you could serve in AmeriCorps. And there's different types of AmeriCorps too. This one happens to be public health. But if you're interested in climate issues, there's also a new climate AmeriCorps that's just been started. Let's take a look at the brief history of AmeriCorps. Actually probably has its roots in the Kennedy administration. John F. Kennedy created the Peace Corps. And the Peace Corps was a very successful program where college graduates could go and serve in another country. And typically these were third world countries. And so they would work on issues in those countries that were important to people, such as water issues, for example. So these Public Health these Peace Corps members would come back, and they were kind of wondering what they could do for America. And so in 1964, the VISTA program was created by Congress and signed by President Johnson. And so this is the Volunteers in Service to America Act. And then after this, there were several other sort of core agencies devoted to volunteerism and service. And then in 1992, President Clinton created the Public Health AmeriCorps program. And so it sort of combined a lot of these different programs like VISTA and other programs. And so that's how AmeriCorps came into being. And here in Ohio, Serve Ohio manages all the AmeriCorps programs. So it was created to empower the local communities to mobilize AmeriCorps members and volunteers with the purpose of building stronger communities. So Public Health AmeriCorps, some of the basics here, it was created not too long ago. And it's a partnership with the Centers for Disease Control and AmeriCorps. And it really is it's a strong program. It has potential to be a strong program because it leverages the expertise of both agencies, namely AmeriCorps' experiencing managing some of the most prominent public service and workforce development programs in the nation. And then the CDC, of course, has the expertise and the funding to do public health work. The program seeks to recruit and build a new workforce ready to respond to the nation's public health needs. And it represents a $400 million investment of the CDC's money from the American Rescue funding. And the Public Health AmeriCorps has two sort of overarching goals. And the first is to help the public health needs of local communities, providing capacity and support to state and local public health settings, and advancing a more equitable health outcomes for communities who are currently underserved. And then the second goal is to provide pathways to public health for people that are interested in public health related careers or even medical careers by providing exposure through shadowing and training, and then getting that experience in the community doing public health work. So we recruit AmeriCorps members who reflect the communities in which they serve as well. There were a lot of problems that were exacerbated by COVID-19, and we realized many of the challenges facing public health in our country. We really need a stronger workforce to address pandemics such as COVID-19. And we believe that the Public Health AmeriCorps provides a valuable opportunity to engage new communities and individuals in public health, exposing them to a diverse range of public health careers that do exist. And the program will be one part of helping develop a robust and diverse workforce to face many of the public health challenges of the future. And here in Ohio, we have several hubs, and these hubs work with public health corps members that are regionally based, and we help them develop partnerships with public health and extension, but also like schools and businesses within the community to address health concerns and public health concerns. This is a map highlighting where our hubs are located. We have a hub up in the Northwest, Lucas and Wood counties. And then we have one in Cuyahoga County, one in the Mahoning, Stark, and Portage County area, one in Morgan and Washington counties. And then this is the hub which South Center is a part of. It's kind of like a South Central hub. Although, we do have members who reside in counties outside of these circles. For example, we have a new member that's in Greene County. So they're just more or less hubs that support training, and then there's supervisors in these various hubs that work with the Public Health AmeriCorps members and help them get started in their communities and provide supervision and support. So we do have evidence that these volunteer and service programs can be successful in addressing public health issues. One of the focuses is helping trying to advance children's health and educational success. And then we look at things like promoting equity and access to health and education, and also economic opportunities. And so, kind of gets into this idea that really trying to provide support for communities that have challenges in terms of, people accessing healthcare. There might not be quality schools, because if you grow up in one of these environments, you're less likely to be healthy. And so we know that, for example, diabetes rates are higher in communities that don't have access to healthcare resources. They might not have opportunities in education. They tend to be lower income. So providing those services and support to those communities that need it, it's really in our core mission. And we do focus on health promotion and prevention of chronic diseases by strengthening the public health workforce and addressing many of these sort of social determinants of health, like we just talked about, health and education, housing, those types of things. Extension has a reputation of working with agriculture, and in fact, the extension gets credited for really for the agricultural revolution that we've seen in the past 200 years or so. And so now Extension is really taking a look at, how can Extension support healthier communities? How can we address rising obesity and diabetes and cancer rates, for example? And so we created this cooperative extensions framework for health and equity and well-being. And it really looks at, trying to marshal resources to communities and groups that are experiencing, many of those barriers to achieving health. And it gets at, how do we address those social determinants of health? So how can we improve broadband or transportation so that people can get to the grocery stores and not have to get all their food from the cheap dollar stores where there isn't healthy choices. How can we get people to get vaccinated, for example, to get them to the doctor if they don't have reliable transportation. So we're looking at all these factors that can influence health and well-being. And Extension also does provide education, such as, I've talked about Dining with Diabetes, for example, which is an educational program for individuals. But we're offering those programs, but we're also looking at some of those upstream influences on health, on health on health, the social determinants of health. But Extension is really good as well at pulling together partners in the community and engaging with the communities around topics such as health. And so, we've traditionally been sort of the experts where a farmer would come to us and say, hey, I've got this pest that's destroying my corn. What do I do about it? Well, rather than experts, Extension is kind of evolving to engagement. So we're asking communities, what are you concerned about? And then how can we help you address those issues? And so those are sort of some overarching goals of the Public Health AmeriCorps. But some of the specific models that we use are one of them is called the IDEAS model. And this is sort of a model that Public Health AmeriCorps members, and Julia might talk about a little bit, they might use to develop a program. And the idea of the model is all about trying to identify, assessing a community, trying to identify what health issues or concerns there might be, and then pulling together those partners and resources to address that problem, developing a program that might address that problem. So some examples of projects that Public Health AmeriCorps might support could be behavioral health issues, substance use disorders. There are some members that are addressing specifically vaping in schools, for example, and trying to create some prevention education programs so that teenagers don't get addicted to nicotine and vaping. But also there could be some COVID-19 recovery and testing, vaccination. We do have a vaccination program called Excite here in Ohio that I've worked with, and we're trying to promote adult vaccines. And of course, health equity, social determinants of health. There's projects that are addressing housing and transportation, education, and then really looking at access to services, reducing barriers to care. So, different activities might include health education, training, outreach, engagement, referring people to programs and services, and then collecting data, analyzing data, assessing situations. So helping communities understand what health problems there might be, and then trying to marshal resources and partnerships to address those issues. So that's a 30,000-foot view of Public Health AmeriCorps. And now I'd like to introduce Julia Shin, and she is one of our Public Health AmeriCorps members. She was in our first cohort that started in May. And so I just wanted her to talk about some of her experiences working with Public Health AmeriCorps.
Yeah. Hi, everybody. Thanks for having me. So I'm Julia, and I actually graduated from Ohio State University with a sociology degree in 2022. And I decided that I wanted to take some time to kind of explore my options before learning about public health a little bit more in depth. And so this program was a really great way for me to explore what public health looks like and what public health means. One thing that I found really helpful and useful is just expanding your idea of what public health is. It's not just making sure you get your shots at the doctor. It can be anything from making sure you have safe housing to do you have good sidewalks. All of these are factors that can affect your health and well-being. And it's a more holistic view of health. And so I was really particularly interested in seeing what public health looks like at a community level. And so I was really interested in seeing how community health organizations, whether they're health departments or organizations like OSU Extension, or nonprofits that support, let's say, unhoused populations, how all of these disparate organizations come together and work on one single health issue. That's something that I was really interested in seeing, was what it looks like at the community level. So this program was a really good fit for me, because that's exactly what I do. Right now, I'm working in Pickaway County, where we've been working on several projects, and I've gotten to be introduced to the community as coming in even as an outsider, and learning a lot more about what the community health needs are. So, for example, in Pickaway, some needs of the community include, having good transportation, because it's a more rural area. Transportation is extremely important to being able to access health resources. And if you don't have a car, then you can't really get anywhere. So I got to sit in on some really interesting community meetings about, what people are doing in the community, what health organizations are coming together to support the community, and improve everybody's health and well-being, which was really incredible. So some other things that I get to do, though, are work on individual projects. So one of our efforts is to really get kids and youth, and any community members really to just start thinking about their own ability to address community health. So one example is when I was working in Cuyahoga County, I got to go into a free summer school at Paul Dunbar Elementary, and work with anywhere from kindergartners to eighth graders to start talking to them about health and understanding community health. And there I had some really good conversations with kids, like how our mental health affects our physical health, or how our social health, and having good friendships is important as well. And how these are all really important factors to maintaining our health and well-being. And then the other thing that I really enjoy doing is being able to empower these kids to start thinking about what they can do for their community to start addressing these issues. So using our ideas model, we had several kids come up with some amazing ideas for addressing health topics. So one of our kids, for example, was able to start thinking about, he identified a community health problem, which was that social media is doing a lot of harm to young people. And he came up with a challenge that was a 10-day challenge to basically get off of social media and to have your parent do it with you. So that way you can keep yourselves accountable. So a 10-day challenge of no social media, and see how that affects you and reflect on that afterwards. So these kids come up with all of these amazing ideas just on their own. Like, they really are community experts. They understand what's going on. And we're just there to facilitate them in order to develop their own health intervention projects, which I think is really amazing and wonderful. Another really great aspect of this program is I've gotten some awesome professional development. And I think that that's a really strong program. So if you are interested in a public health career, and it could be anything, public health has many arms. There's environmental health, there's clinical health, but this program is focusing on social determinants of health. It can be really broad, and you can tailor it to your interests. So if you're interested in a public health career, I would really recommend this program as a way of stepping into the field. As we know, the public health field really needs people who are invested in their communities to do public health work. And it's very important. So
How did you learn about AmeriCorps? And were you able to join?
Okay, so how I was able to join AmeriCorps was I was just looking around online at different job postings. As an OSU alum, a lot of job postings are listed on Workday. But even if you're from outside of OSU, you will be able to find these job listings online. We even have a website as well that we can direct you to. But I just found it on my own through Workday and applied through there. That's how I got introduced to this program.
So other individuals, if they're interested in AmeriCorps, can also apply?
Yeah, so the great thing about our cohort is even starting with the first cohort, we've had a lot of diversity in backgrounds. So we have people who are out of college like I am, but you don't have to be a college graduate. You just have to be 18 or older. But we have people who are much older, like in their 50s or 60s, who are really key community advocates. They already have existing networks in their community, and they're interested in supporting public health in their community. And that's really all that it takes is just a desire to learn, an interest in public health. You can be of any age. You don't have to have any particular education. You just have to be 18 or older and interested in public health.
Now, is this a volunteer or a paid position?
Yeah, so that's a great question. So AmeriCorps, all AmeriCorps service is considered volunteerism, but we are supported with monthly stipends for food and housing and things like that. So these stipends are pretty helpful. We get them at the around the first of each month until the end of our service. Another great benefit of AmeriCorps is after you complete your service, you are entitled to an education award if you want to pursue any further education. So in the future, I'm looking forward to hopefully starting a Master's of Public Health degree and an education award. I'll be able to get an education award from this program to put towards my MPH, which is really awesome.
But how have you found, Dan, working side by side with AmeriCorps? Has it been a tremendous boost to the educational programs for you?
But there's a couple times where Julie and I collaborated on some work with vaccines to promote vaccines. And Julia, she didn't mention this, but she has an art background, so she was able to kind of put her creative talents to work to help us develop some educational materials about vaccines. And we, at the Farm Science Review that OSU Extension sponsors in London, Ohio, we had an entire booth that was focusing on vaccines. We collaborate with College of Pharmacy. And so, Julia was able to work with us on that. And then we had another booth that supported sustainability, so getting people to produce less waste, especially like use less single-use plastics to prevent pollution and that type of thing. So Julia was very helpful to us kind of at the state level to work on those things. And then she's been able to work with, as she mentioned, the extension educator, Jessica Lowe in Pickaway County to support and perhaps extend some of her extension work as well, in which that was sort of health focused. So it has, I think Julia has experiences have shown that or demonstrated that public health members can support extension and support public health work in the communities to extend their work. Just a few words. If you're interested, if you know somebody who's interested in serving as a public health AmeriCorps member, I could give you my email address, or our director is Emily Dreerup, and we can, you can contact one of us and learn about how you might apply for a membership in the next cohort, which we'll be hiring in December. After December will be our third cohort. So very much interested in having a talented pool of applicants for this next cohort.
And Julia, what would you like to leave the listening audience, the viewing audience with regarding your experiences with AmeriCorps?
Yeah, I would like to say, this program has been really, I've been able to experience a diverse number of things, diverse topics, and really be able to have the flexibility to pursue my own interests as well. And so I would say like this program is what you make of it. It's what you put into it. And for anybody that, has an interest in public health, I would really recommend this program as a great starting ground to hopefully a public health career.
Even an extension career too. So
yes, that's true.
Have you ever given any thought to joining the Peace Corps?
So the reason why I picked this program is because I was interested in the United States, and Peace Corps is international. And so, the US is what I'm familiar with, and what I learned about in school is that public health ecosystem and sort of the social ecosystem as well. So I really felt comfortable and invested in the community, even here in Columbus, learning about health issues that people in Ohio face. That's why I really was interested in this program rather than a Peace Corps program.
Hey, we're talking with Dr. Dan Remley, Food, Nutrition, and Wellness Specialist with the Ohio State University Extension Program. And we're also talking with Julia Shin. Julia Shin is a service member with the Public Health AmeriCorps. I want to thank both of you. Great program. Learned a lot. So thank you.
Thanks for having us.
Thanks, Patrick.